Breaking news from Burkina Faso. President Ibrahim Traoré has just unveiled a revolutionary plan that could change the future of healthcare not only for his country, but for all of Africa. A fleet of mobile clinics, small hospitals on wheels, are being deployed across the nation. They will travel deep into the villages, cross rivers and dusty roads, and bring doctors, nurses, and medicine straight to the people. For millions who once had to walk hours or even days just to find a hospital, healing is now coming home.
For decades, the people of Burkina Faso have lived with an invisible wound, not a wound of war, but of neglect. In the remote parts of the country, where the land stretches dry and endless, healthcare was a dream too far. Many families lived entire lives without ever seeing a doctor. Mothers gave birth at home, guided by faith and fear. Children with fever waited for relief that never came. The sound of an ambulance was something they had only heard in city radio reports. In villages where the sun burns through the skin, disease often felt like destiny. The crisis was never about laziness or lack of will. It was about distance. It was about a mother holding her sick child at midnight, knowing the nearest clinic was more than 70 kilometers away. It was about a farmer too poor to buy fuel for a motorcycle ride to town. It was about communities that time and geography had forgotten. Each year, thousands died not because medicine didn't exist, but because medicine couldn't reach them. The problem was not just medical, it was moral. Ibrahim Traoré saw this not as an impossible challenge, but as an unfinished duty. To him, leadership was never about sitting in the capital and giving orders. It was about walking the same dusty roads his people walked, feeling the same sun that beat down on their backs, and asking one simple question: what do my people need most? When the answer was health, he did not wait for foreign aid or slow bureaucracy. He decided that if the people could not reach hospitals, the hospitals would reach them. That was the birth of the mobile clinic revolution. The idea was elegant and deeply African. Use what you have, move with what you can, and reach everyone. Each van would be equipped with life-saving tools. Basic diagnostic machines, first aid kits, medicines, vaccines, and solar-powered refrigeration. Inside, there would be 2 trained nurses, a community health worker, and a driver skilled in emergency care. Every journey they made would carry not just medicine but hope. At first, the concept seemed too ambitious. Critics said it couldn't work, that Burkina Faso didn't have the money, the fuel, or the infrastructure to maintain such a system. But Traoré believed in something more powerful than money: people. He turned to local engineers, local mechanics, and local medical schools. If others can build planes, he said, we can build vans. The vehicles were assembled using locally sourced materials, some converted from old government trucks, others newly built in domestic workshops. The engines were modified to run partly on biofuel made from local crops, like jatropha and groundnut oil. When the first convoy of white vans rolled out from Ouagadougou, people stopped to watch. Children ran beside them. Men removed their hats. Women waved their scarves in the air. It wasn't just about healthcare anymore. It was a symbol of rebirth. Burkina Faso was saying to the world, we are not waiting to be saved. We are saving ourselves. Each mobile clinic is a world in motion. Inside one van, you might find a mother holding her newborn while a nurse gently checks the baby's heartbeat. In another, an elderly farmer sits quietly as his blood pressure is taken for the first time in his life. The air smells of disinfectant, but also of faith. The nurses smile, knowing that for many of these patients, this visit is the first medical care they've ever received. Every injection, every tablet, every bandage becomes an act of national healing. Traoré's philosophy is clear. Development must touch the people first. Big speeches and skyscrapers don't heal the sick. Compassion does. His vision places human dignity at the center of progress. He once said, a nation is not strong because of the buildings it has, but because of the lives it saves. That line now echoes across villages whenever a mobile clinic appears on the horizon. The plan is bold and carefully structured. In the first phase, 150 vans are being deployed across the 13 regions of Burkina Faso. Each van covers about 10,000 people, visiting several villages per week. They provide vaccinations, prenatal care, malaria treatment, and emergency response. Over time, specialized vans will be added, some for dentistry, others for eye care, and even small surgical units. The long-term goal is to have 500 fully operational mobile clinics within 5 years, ensuring that no Burkinabe lives more than 30 kilometers from essential medical services. But this is more than just a healthcare initiative. It's an ecosystem of opportunity. Local welders build the van frames. Mechanics from Bobo Dioulasso and Koudougou maintain them. Young Burkinabe doctors who once dreamed of leaving the country now see a reason to stay. They are part of something greater than a job. They are part of a movement. Each new van means more local employment, more training, and more self-reliance. Inspiration for this model comes from beyond Africa's borders, but the heart of it is uniquely Burkinabe. In India, similar vans reduced maternal deaths by nearly 60% in remote provinces. In Brazil, the Saúde, or Health on Wheels, program transformed the Amazon, reaching villages deep in the forest. In Kenya, solar-powered clinics changed the game for nomadic communities. Burkina Faso looked at these examples and said, if they can do it, we can do it our way. And that our way makes all the difference. Each mobile clinic is a promise. A promise that no child will die for lack of a vaccine. A promise that no mother will lose her baby for lack of care. A promise that health, the most basic human right, will no longer depend on where you were born. For too long, the people of Africa were told that progress had to come from outside. But now, the message is clear. Progress begins at home. Economically, the project is a masterstroke of efficiency. Preventive care always saves more than emergency treatment. By treating diseases early, the mobile clinics reduce hospital congestion, lower national healthcare costs, and keep citizens healthy enough to work and learn. Farmers spend less time traveling to hospitals and more time in their fields. Children attend school more regularly. The ripple effect spreads through families and communities, strengthening the nation's productivity from the ground up. The environmental vision behind this plan is equally powerful. The use of biofuel cuts emissions. Solar panels on the vans provide clean energy for lights and refrigeration. The project even trains local communities on how to manage medical waste safely, reducing pollution and protecting the ecosystem. Health and sustainability walk hand in hand, because saving lives shouldn't harm the planet that sustains them. But beyond the statistics, there are moments that remind everyone why this matters. In a small village near Kaya, a young girl named Amina once suffered from severe anemia. Her parents couldn't afford transport to the city hospital. Then, one morning, the mobile clinic arrived. The nurse examined her, gave her medicine, and arranged a follow-up visit. Within weeks, she was running again, laughing with her friends. Her father later said, "We didn't just get treatment, we got our child back." In another region, an old man named Seydou, who had lost sight in one eye due to infection, finally received proper medication when the clinic came to his village. He smiled and said, "I thought the government had forgotten us, but now I see again. Not only with my eyes, but with my heart." Stories like these spread faster than the vans themselves, and soon, entire villages began to organize schedules to welcome the clinics with songs and traditional drums. This project has become more than policy. It's a people's movement. Communities help guide the vans, repair the roads, and even volunteer as local health assistants. Traditional leaders bless the vehicles before their first missions. Children follow behind, shouting, "Our doctors have come!" And for the first time in generations, the relationship between the people and their government feels alive, close, and human. Strategically, this project also strengthens national independence. Burkina Faso no longer needs to depend on costly foreign medical missions. It produces, manages, and sustains its own healthcare network. The knowledge gained through these mobile clinics is now being shared with neighboring countries, Mali, Niger, and Ghana, building new bridges of regional cooperation. In the Sahel, where conflict and poverty once divided nations, healthcare is now becoming a force of unity. The world is beginning to take notice. Health organizations, African media outlets, and independent researchers are calling Burkina Faso's initiative one of the most innovative grassroots healthcare models of the decade. But for Traoré, recognition is not the goal. He often says, "We don't do this to impress the world. We do it to heal our people." Every van that leaves the capital carries more than equipment. It carries a message of hope. A message that Africa's answers are not hidden in foreign aid, but in its own courage. When a nurse wipes sweat from her forehead under the scorching sun, when a driver pushes through a muddy road just to reach one more village, that's not just work. That's patriotism. So if you are watching this, don't scroll past. Share this story. Talk about it. Because this is not just Burkina Faso's story, it's Africa's story. A story of resilience, of faith, of leadership that listens and acts. Tell the world that while others build weapons, this nation builds healing. While others talk about change, this one drives it literally across the savannah, one van at a time. Support this vision. Subscribe, share, and spread awareness. Let's show the world that the revolution of dignity has already begun. Not in the halls of power, but on the dirt roads of Burkina Faso, where every horn that sounds from a mobile clinic is the sound of life returning. Because sometimes the most powerful revolutions don't happen with armies or speeches. They happen quietly, inside a white van, where a nurse takes a child's hand and says, "You are going to be okay."